As a newsroom, part of our job is to keep a close eye on what happens in our community every day. We listen to police scanners from surrounding agencies, and one call that seems to come in on a daily basis is medical assistance needed for an overdose. Fox 9 Now's Karen Lair caught up with Ada County Paramedics to learn about their role in combating the opioid epidemic in tonight's installment of Finding Hope.
While those overdose calls also include alcohol and other drug-related calls, a large number of them are opioid-related, some of them even deadly. And of course, those minutes immediately following an overdose are critical in saving someone's life. That's where dispatch and local paramedics step in to help.
We see the worst end of the spectrum.
Ada County Paramedics operate on the front lines of the opioid epidemic.
These calls can occur in the most affluent area of town, or they can occur in an alleyway and everywhere in between.
Most overdoses called into dispatch will see a response from local police, fire, and paramedics.
We bring basically a mobile emergency room to the patient's side.
Possibly the most important part of that life-saving kit is Narcan, also called naloxone, an opioid overdose antidote.
It is what they use in the emergency department, it's what we use on ambulances, and it may be what you find out in the community.
The drug can be administered as a shot, an IV, or most commonly as a nasal spray.
This pops on, and then it simply sprays a mist up into the nose.
Some patients, though, need more than one dose. In 2017, Ada County Paramedics administered naloxone to about 180 opioid overdose patients using 276 doses, essentially saving someone's life every other day.
That is relatively mild compared to back east, where agencies are doing that many in a week or a month period.
But compared to 2016, the use of Narcan in the county went up 62%. That year, paramedics used 157 doses to treat roughly 112 patients. And keep in mind, those statistics don't include patients who died before medics arrived or overdoses that didn't need Narcan.
A larger portion of those are opioids that didn't.
But before paramedics even make it to the scene, immediate help comes first over the phone from dispatch.
So the dispatcher has a series of instructions, a series of tools that they can use to both help and make sure that the scene is safe for us to arrive.
Dispatchers play a major role in walking bystanders through resuscitation before paramedics pull up on scene.
Our dispatchers can talk somebody through how to administer naloxone. They can talk somebody through how to do CPR if needed.
Cole says the agency's been dialed in on the proper response to opioid overdoses for 2 decades.
Pretty much been unchanged for the past 20 to 30 years.
The potentially deadly aspect of an opioid overdose is when a patient stops breathing. But
the good news about that is relatively easy to treat compared to other types of overdoses. So a bystander, even if they did not have naloxone, if they knew how to do rescue breathing or they knew how to do basic CPR, can be very effective until professional help arrives.
One outcome trickling down to some agencies across the country as a result of the opioid epidemic is the rising cost of naloxone. Fortunately, though, officials with Ada County say they've not yet seen an increase on a local level. Their last order placed just this January cost the department only $300. Reporting in the studio, I'm Karen Lair, Fox 9 Now.